Hey guys, I'm Dr. Jason Barker with the Natural Athletes Clinic, and I wanted to make a video today about seasonal affective disorder, otherwise known as SAD. So this is seasonal depression. You tend to see this ramp up in the fall and get worse through the winter, and then a person who has this starts to feel better in the spring. And essentially this is a biochemical imbalance that's precipitated by a lack of daylight, less sunlight. Seasonal affective disorder starts at the same time of year and ends around the same time of the year for people who suffer from this. So this is different than clinical depression, where a person is going to be depressed year-round. So we don't know all of the causes, but some of the main ones are that we know when we're exposed to less sunlight, we tend to make less of one of our feel-good hormones, which is known as serotonin. So serotonin levels go down, and then conversely, the more dark that we're exposed to, we tend to make more of our melatonin. Melatonin is our sleep hormone. It helps us sleep. So one thing you'll see if you're suffering from SAD is that you'll want to sleep more. Ironically though, the melatonin balance gets, or the production gets imbalanced, so it also can lead to sleep disturbances. So what are the symptoms of seasonal affective disorder? Well, it's just, this is essentially depression. It's you're low mood, you're not motivated, you tend to gain weight, you tend to have pretty intense cravings for simple carbs, breads, pastas, things like that. That obviously helps you gain that weight. So how can we take care of seasonal affective disorder? Well, the best medicine is exercise. So there are lots and lots of good studies that show people who go to the gym, and even under the commercial lights inside of buildings, that light actually helps them, and so does the exercise. Just 3 to 4 hours a week has been compared to, or it's as effective as taking regular antidepressant medication. However, you're depressed, you probably don't feel like going to the gym, although most people watching these videos are probably pretty avid exercisers. So if you're exercising and you're still feeling like you have SAD, there are 3 other natural medicines that I really like to use and that I found effective with patients in the clinic. First one are essential fatty acids, or we get these from fish oil, so just straight omega-3. Make sure you're only taking omega-3s. Probably a dose of around 2,000 milligrams a day is very helpful for balancing emotions and supporting mood. Of course, you should be taking fish oil or omega-3s year-round because they have so many great benefits, namely they're very powerful anti-inflammatory. Second natural medicine I really like to use is 5-HTP, or 5-hydroxytryptophan. This is an amino acid complex. It's a tryptophan donor in our body, so your body will snatch up that tryptophan and make serotonin out of it. Serotonin, of course, will help lift your mood. So you may be worried about taking 5-HTP and getting a little bit drowsy. You don't tend to see that side effect in a lot of people. It can certainly happen, but usually as soon as you take that and you're low in serotonin, your brain will synthesize that tryptophan and make the serotonin out of it, so you should not feel too drowsy taking it. And then the third natural medicine we like to use a lot is St. John's wort. So you've probably heard of this herb. It's very well studied, been around for a long time. St. John's wort is great stuff because it elevates serotonin and it elevates dopamine, our 2 main mood hormones. So of all those things that I just mentioned, of course, exercise is going to work the quickest. The next fastest or effective medicine that you can use is the 5-HTP. That works pretty quickly. That'll raise your mood today as soon as you take it. Omega-3s will start to work within a week or so. You'll notice a change. St. John's wort, unfortunately, takes several weeks for it to kick in and start working. So if you're using this and you're experimenting with it, make sure that you give your body enough time to incorporate it and let it start to work its balance out. Okay, so if you found this video helpful, please give it a like. If you know somebody who suffers from seasonal affective disorder, which about 20% of the population does, please share it. And of course, please subscribe to our channel. We've got a lot of great videos and we're always making new ones. All right, thanks guys. Hope you feel well this winter.